Hello parents, myself Dr. Anupriya. This video is a summer guide for your baby. So we'll break it into why do babies need special care in summer? The summer challenges a baby faces. Skin care during summer, feeding during summer, hydration, clothing, how to protect your baby from insects, water safety and how to create a cool environment. So what are the summer challenges a baby faces? So firstly, heat related. So heat rash, heat exhaustion, heat stroke, dehydration, skin issues like sunburn, diaper rashes, dry skin, infections like gastrointestinal infections, respiratory or skin infections, and lastly insect bites. We'll learn about it through the video. Why do babies need special care during summers? So babies have a less developed system to regulate the temperature compared to adults, making them prone to overheat. Also, high temperatures and humidity leads to rapid dehydration, which is very dangerous for babies. Babies have a very delicate skin, making them prone to sunburn and irritation from the heat and sweat. The increased presence of insects during summers make them prone for insect-borne diseases. So what are the summer challenges a baby faces? So firstly, heat related. So heat rash, heat exhaustion, heat stroke, dehydration, skin issues like sunburn, diaper rashes, dry skin, infections like gastrointestinal infections, respiratory or skin infections, and lastly insect bites. We'll learn about it through the video. So skincare during summers. So first of all, use gentle cleansers. Use mild, fragrance-free baby soaps which are gentle on baby's skin and avoid harsh detergents which can wipe away the natural oils. Now how can you prevent heat rash? So dress your baby in loose fitting clothes of natural fabric like cotton. Keep baby's skin dry, especially the folds. Give frequent lukewarm baths to keep the skin cool and avoid thick creams or ointments which can block the sweat glands. Now how do you protect your baby from sun? So minimize sun exposure between 10 am to 4 pm. Seek shade from trees, umbrellas or canopies. Dress your baby in loose fitting clothes of natural fabric which are lightweight and can use wide brimmed hats. For babies 6 months or older, you can use sunscreen. Choose the ones with broad spectrum with SPF of 30 at least. Can reapply often. Moisturizing and hydration. So use a mild, fragrance-free moisturizer for your baby's skin to prevent dryness. Make sure your baby is well hydrated, be it breastfeeding or formula fed. Feed frequently. How to keep your baby hydrated? So infants are at higher risk to develop dehydration due to higher water body content and inefficient kidneys in conserving fluid. So what are the dehydration signs? Dry tongue and mouth, decreased urine output, lethargic, sunken eyes, breastfeeding or formula frequency. So breastfed babies should be frequently fed on demand. Formula fed babies may also need frequent feedings recommended by your pediatrician. Now what about introducing water? So babies less than 6 months of age who are formula fed or breastfed don't need additional water. For babies over 6 months who have been started on solids, you can offer small amounts of water in between the feeds. Feeding in summer. So breastfed moms should be adequately hydrated and should have a balanced diet to maintain milk supply. Prepare formula as per the instructions on the packet. Store the prepared formula safely and discard any leftovers. In hot weathers, be extra cautious about formula spoilage. If you are introducing solids, try to give hydrating fruits like watermelon, cucumber. Ensure food is fresh and properly cooked. Avoid the ones which get easily spoiled in summer. So clothing in summers. Opt for loose fitting, natural fabrics like cotton, linen, muslin so that air can circulate easily and prevent overheat. Prefer light colored clothes because they reflect heat better than the dark ones. Wide brimmed hats can protect babies' forehead, face, ears, neck. Lightweight long sleeves and pants can provide extra sun protection, especially when outdoors. Now, how do we manage the heat issues? So firstly, we need to understand what is heat exhaustion, what is heat stroke. So heat exhaustion will have heavy sweating, rapid breathing, patient will be dizzy, nauseous, pale or cool skin. Whereas heat stroke is a medical emergency. Patient will have hot, dry skin, high-grade fever, confusion, seizures, or even unconscious. Recognizing the signs of overheating. So baby will be fuzzy, irritable, excessive sweating, flushed skin, and rapid breathing. Next, how do you cool down the baby? First of all, shift your baby to a cooler, shaded place. Remove excessive clothing. Cool down baby's temperature with a damp cloth or lukewarm water. Offer fluids, breast milk or formula feed or water as per the age. Next is insect bite management. So first of all, you need to be aware of the prevalence of diseases like dengue, malaria, which are transmitted by mosquitoes. Use insect repellents sparingly in babies. Consult your pediatricians about age-appropriate repellents which can be used for your baby. Avoid repellents containing DEET in infants less than 2 months. Now, what are the protective measures which you can take? Safest are the mosquito nets. You can use it over the crib, strollers. Dress your baby in long sleeves and pants, especially during the dawn and dusk when the mosquitoes are most active. Avoid areas with high mosquito activity like stagnant water. Next comes the water safety. So, pool safety guidelines. Never leave a baby unattended near any body of water, even for a second. Make sure that a responsible adult is always there to supervise your baby. Use proper flotation devices which are age appropriate and approved by safety standards. Next, bath time precautions. Always supervise your baby during bathing time. Check the temperature of your water carefully to avoid scalding. Use non-slip mats in the bathtub. How to prevent drowning? Drowning can happen quickly and silently. It happens within seconds, you won't even realize. So make sure you empty the buckets and containers immediately after the use so that baby doesn't drown. You can consider infant swimming lessons which are very useful for babies. How to maintain home environment? So room temperature and ventilation. Keep the baby's room cool and well ventilated. Use an air conditioner or fan to maintain a comfortable temperature. Ensure proper ventilation to prevent stuffiness. Then safe bedding. Use light cotton sheets. Avoid any loose beddings in the baby's crib to reduce the risk of SIDS. Avoid heavy blankets or quilts which can cause overheating. Nap time routines. Establish a consistent nap time routine even during summers to help baby regulate their sleep pattern. Create a dark and quiet environment for naps.